Doc, first of all, what is priapism?
No, okay. So let me first say a good afternoon to your cherished listeners. Basically, this is an interesting topic. So priapism simply refers to a disorder in which the penis maintains a very long or prolonged and rigid erection in the absence of appropriate stimulation. So the penis is erected for a very long time, and in this instance, there is a lack of sexual stimulus. So the definition of priapism basically focuses on the duration, but for every erection that lasts above 4 hours or longer is considered a priapism. Based on this, we have broadly about 3 categories of the disease. We have the ischemic priapism, the non-ischemic priapism, and recurrent priapisms. Ischemic priapism among these is a cause of priapism that is a true emergency. When it happens, you have to run, and this requires prompt intervention to prevent damage to the penis. And this can prolong or progress to cause complete or permanent erectile dysfunction. So the emergent management...
Erectile dysfunction?
Yes. So if it is prolonged enough, it can lead to permanent erectile dysfunction. So it's a serious urological emergency that we have to deal with. So as I mentioned earlier, priapism broadly is categorized either as a low-flow priapism, that's the ischemic type, or a high-flow priapism, which we call the non-ischemic type. And simply the flow refers to when you have blood flowing through arteries, the pipes that carry blood within the body. And the causes of the ischemic priapism, there are a lot of them. But the commonest causes we have are when you do injections of medications to keep an erection, or when you have certain hemoglobinopathy, so some blood disorders such as sickle cell disease and thalassemia, or you have any disease that causes your blood to easily clot, so hypercoagulable states. These are the commonest causes of the ischemic type of priapism. So basically, it is important to mention that about 2/3 of the patients we see with priapism, the cause is usually those that are seen to be injecting drugs into the penis. So when you have an erection and you feel the penis, there are these tense areas. It's blood that fills those areas. And some people go on to inject certain medications into these areas, the corpora cavernosa. And this basically they do is to treat their dysfunction, their erectile dysfunction. So those that have weak erections want to have a sustained erection so that they can have adequate sexual intercourse. So they go on injecting these medications into this cavernosa. About 2/3 of the patients we see fall in this category. Sickle cell disease also accounts for a large number, especially in our part of the world where sickle cell disease is very common. So in the males, we see about 40% to 80% of cases coming with priapism at one point or the other. For pathophysiology, what causes priapism is not well understood, but let me just put it in layman terms. So, as I mentioned, for you to have an erection, you need blood to flow through the cavernosa. There are 2 on the sides in the penis. So when the blood flows in there, it becomes tense and hard. That's what we call an erection. But then when the blood flows in, it should be able to leave the penis because blood carries with it oxygen and other nutrients for the cells within the penis. So when the blood moves in there and the oxygen is removed, carbon dioxide is put back into the blood and other waste products enter the blood. So when this blood is unable to leave the penis within the shortest possible time and becomes stagnated there, then we say that there is a block in the drainage within the
and but dog, that thing not be easy like that, oh.
Serious like that,
so on the face value, you think it's just an erection, but there are a lot of things that happen. Okay, so basically, when you have this blockage of blood flow, so blood enters the penis, is unable to come out, and it lasts longer than 4 hours,
Hey!
then you have a priapism. So the blood is in there, there's no flowing out, and it's taking you 4 hours. You are not having very strong erections. You are running into a priapism.